All right, Doc Pawsitive here at the Paws Veterinary Clinic. Strangely enough, we're here with Tala. Now, Tala, I had posted on my Facebook page this morning. Cute puppy with a cute kid. Posted her on Facebook, and then she came in, maybe an hour ago, emergency visit. Dad is a contractor working around the house. Tala came, and she was chewing on some rat poison. Never good with a puppy. Puppies investigate their environment with their mouths. Everything is in the mouth. Dad said yesterday she chewed his laptop cord. Puppies chew cell phones. Puppies chew a lot of stuff. But when they find that rat poison in the garage, that's bad. Dad came in. He had already called poison control. All these poisons have an 800 number on there. You call, they will assign you a case number. But Dad did the right thing. He got her here because with a lot of these rat poisons, one of the things is getting them to vomit. So Dad, he was handing me the case number and the 800 number. I don't even call. I induce vomiting first. I call later because if we can get as much of this rat poison out of their stomach as possible. And how we do that is old school. Right there, hydrogen peroxide. Now, Dad will tell you, she loved it. Right.
Yummy.
They fight it. And I don't give them teaspoons or capfuls. I pour it down their throat until they puke. And puke and puke and puke. Because as much of this stuff as they get out of their stomach means it's less to get absorbed into their bloodstream and have to deal with later. So we got her to throw up, lots of throwing up, get her stomach empty, then call the 800 number. And these companies, they will advise you what the active ingredient is, treatment. Some of these drugs are anticoagulants, cause interference with blood clotting, and so animals bleed to death. They need to be treated with vitamin K. This is a newer generation rat poison, bromethylene, which causes cerebral edema, brain swelling. And if the brain swells, the brain is encased in the skull, so when the brain swells, there's no room for it to swell. That's what causes the problem. So we induced the vomiting, and now we just gave her the next ingredient, which is Toxiban. Toxiban, that is activated charcoal. It's basically charcoal to detoxify any remaining poison toxin in Tala's system. Again, they don't like it. They flavor it. They add sorbitol, artificial sweeteners. They try it. It still tastes like putting a Kingsford charcoal briquette in your mouth and sucking on that. Not good. They don't like it. But I don't worry about whether the puppy likes me or not. I worry about keeping it alive. It'll learn to like me again later. So we are putting Tala on steroids, sending her home because we do not have round-the-clock nursing care at Paws. We're a wellness clinic. But they're going to be watching for any signs of cerebral edema, swelling, and those signs would be any staggering, any seizuring, any unequal pupil size, and so forth. Now, I don't want them to drive themselves nuts, and every sniffle, burp, and fart, they're wondering, is this normal? But if she's showing any signs of neurologic impairment, we need to have them call Doc's cell phone and get her back down here to treat accordingly. So, but we're real optimistic. We got Tala to vomit most of that product up. Gave her Toxiban. We're going to repeat the Toxiban activated charcoal in the morning. Dad here, he's a contractor, so he was actually doing a brake job. And no, that's not brake dust on him. That is Toxiban. So he's got to look forward to tomorrow getting his wife to help him get the rest of the bottle of activated charcoal into Tala. She's resting here now. We're going to send her home. But every poison, a lot of the things in the home are overrated as poisons. Chocolate, overrated, onions, grapes, raisins. Rat poison is not overrated as a poison. Antifreeze, not overrated as a poison. So some of these things you got to get to your veterinarian. Consult a qualified veterinary professional. We have a case number. Call that number. They will advise you, but you need to consult a veterinarian. So, more to follow. Bye now.